What's up, guys? Welcome to episode 69 of the unofficial NCLEX podcast. This is entitled Assess Patient Care Areas for Sources of Infection. So when you're providing care to patients, you want to make sure that everything's clean or sterile if necessary. Not too many things require them to be sterile, but most things we need to ensure that things are clean for them. So I want to just go over a few situations. So like, let's say your patient's sick. Well, maybe they had surgery, and maybe their friend that is at the bedside coughing all over their bedside table and you think has a cold or the flu. Like, we need to evacuate that person. Like, that's not helping our patient at all. Other situations include, when you remove the cap from your spike on your IV tubing, when you're starting fluids, you want to make sure that's not touching anything else other than that sterile part of the IV bag that it needs to be inserted into. That's a kind of a break in technique, asepsis, so that could be a source of infection. Maybe if bodily fluids were not cleaned up properly, if you've got a C. diff patient and you're not using those wipes that are specific to C. diff, or if you have a C. diff patient and they are not, the surfaces just aren't being cleaned appropriately, or maybe we're not using the appropriate precautions, or maybe there's a one-time use item that's being used again, kind of thing. So making sure that infectious material is being cleaned up appropriately. A big one is scrubbing the hub. A source of infection is anything that really a connection between the outside world and the inside of the patient's body. So IVs, central lines, Foleys, those things are all sources of infection. So we want to make sure we're keeping them clean, particularly when we're accessing them. So scrubbing the hub 10 times is typically what it is, with an alcohol swab, vigorously back and forth to get all of the little microbes off of there before we access it and push medications in it. Maybe, and arguably, the biggest aspect of this is washing your hands. Can't begin to tell you how important it is to wash your hands when you're going in the room and coming out. If you've got a C. diff patient, you cannot use that gel. You have got to use soap and water. That is part of enteric precautions. So use soap and water as much as possible. And another thing is, I've noticed too, we get so focused on us washing hands that we forget about our patients. We walk them to the bathroom and it takes them feels like it takes them half an hour to get to the bathroom, and then we walk them back, but we forget to stop at the sink and have them wash their hands, or maybe they don't wash their hands well. Or if we notice the family touched the floor and then goes and touches their hand, encouraging patients and families to wash their hands. And I think it's great to, when you admit a patient, to just say, hey, infection prevention is a priority to us. So if you notice any of us haven't washed our hands, or if you didn't physically see it, and feel free to ask us, and we would like to be able to do the same with you, because at the end of the day, the infection prevention is priority. And if a lot of nurses utilize that bedside table to kind of put their meds on while they're kind of giving them and organizing them. I do that all the time. But what's really important is to clean it appropriately. So before I'd set stuff on it, I'd grab a wipe and clean off that bedside table. And also make sure that your connections on lines, drains, and airways are covered and cleaned appropriately. So those are some ways that you can potentially prevent infection in the patient care area. And that concludes episode 69, Assess Patient Care Area for Sources of Infection.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.